Well, good day, everyone. Welcome to Quintessential Applications, What to Do First, Next, and Last. Today's webinar is the QA Clinical Protocol, a demonstration. What is Quintessential Applications? It's a physiologically based, basic science-driven neurological hierarchy for the ordered application of clinical procedures and techniques. All of you who are on this webinar know this. Those who might be seeing it in the future may not. It's based on normal physiology. It's driven by the basic sciences of neurology and biochemistry. It's organized in a neurological hierarchy for the ordered application of clinical procedures. So quintessential means ideal or standard in applications. Systems first, local second, ordered according to a neurological and biochemical hierarchy. It's an open system, open to all techniques and procedures past, present, and future. It uses the manual muscle testing response as a window on neurological function. When manual muscle testing, or with manual muscle testing, guided by the wisdom inherent in the QA clinical protocol, we enter the forest of the patient's symptoms with a map, leading us toward a favorable and often remarkable outcome. The common clinical approach is revised. It's the common approach in all healing professions to look at the patient's local complaints as the primary focus of the initial clinical assessment. The QA clinical protocol revises this focus by insightfully approaching patients presenting complaints as an integral part of their overall physiology. It assesses and treats physiology gone wrong in a systemically oriented, logical, efficient, and clinically rewarding manner. It encourages favorable outcomes by addressing systemic phenomena prior to treating local problems. So when the QA clinical protocol is followed, the optimal time to employ a specific therapy will be revealed and the underlying cause will be resolved. So today's webinar is a demonstration of the application of the QA clinical protocol, and obviously we have just less than an hour to do that demonstration, and patients, as you know, don't come in nice, neat packages where you might take a particular period of time to resolve their issues as in toto or as far as you can. But we're going to go through this process together and see how we do. So we have our subject is a 28-year-old chiropractic physician, Dr. Andrew Leverone, practices in St. Petersburg, Florida, and is studying quintessential applications. He had a left shoulder injury a couple of months ago, a collision with another playing flag football, and he's just told me today he had an injury to his right shoulder in this past week doing some arm wrestling with someone. He has right knee pain, especially at the end of a long day or when squatting, and we'll demonstrate that, from a childhood rope swing injury that was surgically repaired 10 years later. He has left groin pain just lateral to the midline on the left. That was approximately 3 years past. He had a number of incidents where he was struck in the groin wearing a cup, and the cup injured the pubic area. He has fatigue, especially during the middle and at the end of the day, and has an inkling that he may have a little bit of yeast or candida problem. So let us take us to the staging area, and I'm going to be awful close to you when we get there. And good morning, everybody. So this is Dr. Leverone behind us. And this is my treatment room. You can see behind me a plethora of testing substances and nutritional substances that are used in the application of the protocol. Dr. Leverone and I had the pleasure of going through an examination and consultation together. And so we have some demonstrations of limited range of motion and one standing that we're going to perform. His 1 foot standing, you're going to have to trust me on this one, his 1 foot standing with eyes open was 20 seconds bilaterally. So what I'm going to have him do is turn to the side and face me. I think you can see his feet at the bottom of that video. And I'm going to have him stand on 1 foot, right or left. And now that you're stable, I want you to close your eyes. That was 5 seconds with hops. We call that dancing in the vernacular. So that was the right foot. Try it again. Let's see. Try the right foot again. Eyes open. Close them. It was about 7 seconds, and I'm listening to the clock in the background. I don't know if you guys can hear that. I am going to turn the microphone slightly so that it's facing us, just in case the volume was compromised. And now we got 7 seconds on the right foot. Stand on the left and close your eyes. And we're going to try it one more time. Always give the patient 2 or 3 times and take the best number because you want to see if they really improve during the process. Close your eyes. So that was about 6 seconds. So he's got 7 seconds on the right, 6 seconds on the left. We know that he's got some internal, external rotation problems. So what I want you to do is I want you to face the camera and do internal, actually, face this way. Do internal rotation with your right arm. So mark that in your mind's eye, and external rotation with your right arm. Now do external rotation with your left arm simultaneously. So you all can see that difference. Do the right one as well, simultaneously. So do it from the same position. Okay? So everybody see that? Let's turn him this way. Everybody see that? Okay. So his right external rotation is limited. Now do left internal rotation. That's left internal rotation. And then turn around and do right. I don't think they're going to have to see the difference. So you can see the difference in that motion as well. When you touch, and there's discomfort in external rotation on the right and in internal rotation on the left, and you would measure it on the right as a 0 to 10.
It's about a 3, and on the left it's about a 1 or 2.
Okay. And when you touch the left groin area, and if you could face the camera, the pubic bone on a scale of 0 to 10.
When I put pressure, it's about a 6, 5 or 6.
It's a 5 or 6.
If I'm not touching it, it's much less.
Okay. So you can feel it when you're not touching it?
Sometimes, not always.
Okay. So now I want you to squat to the point where you feel the discomfort in your knees, and then you feel it there.
Right, I feel a tightness on the right, yeah.
Right, tightness on the right. And if you go further, does it increase? And how much? Scale of 0 to 10?
3, 4.
3, 4. Okay, we have all those measurements. I've also done a postural analysis, step forward, and we see that his left shoulder is high. His occiput is high on the left. His hips, you can see they're relatively level. Let's have you lie on your back. That would indicate the possibility of a left latissimus dorsi. I did a TS line analysis prior, and I found a right PMS, pectoralis major sternal point, that was present. So I'm going to check the left latissimus, the right pectoralis major sternal against the opposite sides. Clench your teeth, resist. And I'll stay on this side of the table so that you can see me. Clench your teeth. And the latissimus doesn't show up. Resist. Push toward me. The pectoralis major sternal on the right is on the left is okay. On the right, resist. He can't resist with a manual muscle test. So the first thing that we do is we ask the question: is this monosynaptic reflex, this cord reflex, like hitting the knee, operating properly? We call that autogenic facilitation. So we stretch the belly of the muscle, resist, and it doesn't strengthen, which indicates that he has injuries in various places. So one of the ways that we know to evaluate for injury is we rub over the areas of incoming nociception that may be unbridled, in other words, unresolved. So nociception, as you know, when it goes into the spinal cord, has 3 pre-programmed responses. It causes a muscle withdrawal response from the area of injury. It causes an autonomic response, a vasoconstricted response in the periphery, and it causes upgoing pathways to the brain that have many activities, including registration of location, quality, and memory, and reaching the limbic system where you actually experience the pain. So I'm going to rub right here on the pubic bone, resist, and he strengthens under those circumstances here on the inside of the knee, and he strengthens under those circumstances. The shoulder, it was an AC joint, possibly a separation, resist, And that also strengthens, let's do the front of the shoulder on this side. That strengthens. The back of the shoulder on this side, that doesn't. The back of the shoulder on that side, it doesn't. So we have AC joint. We have these three areas that he shares with us. He's also got a scar under the chin, so I'm going to rub that scar. Resist. And sure enough, there's an injury there that needs to be treated. Are there any other injuries? The right ankle, and do you remember what it was?
Yeah, I rolled it really badly in a wakeboarding accident.
So he had a wakeboarding accident. He rolled his ankle. So you rolled it this way?
Inversion. It's actually tender right now if you cut the center.
Here or here?
Right there.
Okay, very good. So let's rub that area. Resist. And he has a strengthening response as well. Now, before we do anything, I'm going to measure another range of motion. Something totally or somewhat removed. And you can see what I tell people, it goes to the very end of the window on my refrigerator on my counter. Very scientific measurement. And this side, look down your toe line. Are you past the corner of my room? No. No, you are not.
It feels tighter too.
Okay, and it feels tighter on that side. Okay, very good. So this was a blunt trauma, so I'm going to have him touch this area. And I'm just going to flick the ankle. When two impulses, sensory touching into the brain and flicking of the ankle, sending proprioceptive mechanoreceptor activity into the brain, when they meet each other and they're the two appropriate impulses, they normalize a pathway relative to the incoming nociception and the adaptation that has taken place. This was also a blunt trauma, so I want you to touch there. Now, there could be some ligamentous injury, and we could choose to do some manipulation of the origins and insertions. This, however, was a recent injury that was not blunt trauma, so what I'm going to do is I'm going to manipulate the musculature in this area with my thumb. Or you can't see the shoulder in the picture, or the grimace on his face. This was a torn area on the ankle, so I'm going to manipulate the ligaments that attach to this area and flick the ankle. Manipulate this shoulder, flick the ankle. Manipulate the ligaments, flick the ankle. This also was a blunt trauma, right?
Yeah.
So I'm going to pinch it instead of having the patient. Here's what I'm doing. I'm pinching it and flicking the ankle. I'm pinching and flicking the ankle. So I, as a clinician, have to make a choice. Resist. Push toward me. There's still a weakness. Resist. And it still doesn't respond to autogenic facilitation. And we have the scar under his chin. Touch there. Thank you. And instead of using his feet, we're going to use his head as the other input. Resist my pressure. Push toward me hard. And now we have a strengthening response, so we need another weak muscle. Clench teeth. And now we have the latissimus dorsi showing up. So in the QA clinical protocol, we use manual muscle testing as a window on neurologic function. And when there's a change in the anterior horn motor neurons of the muscles that we test, because the downgoing and upgoing impulses that pass through those areas, as well as local influences, change the central integrated state, then a previously strong muscle becomes weaker, a previously weak muscle becomes strong. IRT is to restore normal muscle spindle cell control mechanisms necessary for muscular and postural control. So if I stretch this area, clench teeth, he stays strong, which suggests that I've finished my injury treatment. Now, as you can tell, he's almost one of his foot lengths farther in motion, and the tension here has significantly improved. How much farther past you're past the corner of my room now, right?
Yeah. Oh yeah, way past.
And how's the tension in the groin?
It didn't feel very bad.
Okay, so we've done injury recall technique. We've normalized these mechanisms of adaptation in the brain between the cerebellum and the cortex, and we've restored normal muscle spindle cell control mechanisms so we can go on. Now, he has pain in a number of areas. So what I'm going to do is I'm going to sit him up. The only one that was acute was here. The rest of them are chronic pain. They've been longer than a week or two. So I'm going to look at those things that are longer than a week or two and see if we have what we call set point technique. So sit up and face the camera. And I'm going to sit beside you. And you can see me. In fact, scoot over a little bit so we both can be on the table. Thank you very much. Put your fist against the side, clench your teeth. Okay, good. And touch the inside of your knee. Clench your teeth. And I'm going to take off your glasses so you can't see what I'm about to do. And I'm going to tap an acupuncture point on the head. Now, I guessed the gallbladder beginning point because it runs through the area. And 80% of the time, it's going to be the pathway that runs through the area. We already know that when he squatted, he had pain up to a...
Was that 3?
It was about a 3. Where was the 5 or 6? That was at the groin.
Yeah,
Okay.
I was touching it. Just light pressure over it. I can actually, it'll get.
Okay, so I'm going to tap this for about 30 seconds. Now, many of you who are on this webinar do this in your office all the time. I've had the pleasure of having Dr. Schmidt as my personal physician for some 20, 30 years. And as I go through the process of learning my craft and applying the principles that he teaches in his curriculum, in the curriculum that we now teach together, being in his office and being treated by him has been very helpful in expanding my understanding of how to use these particular procedures most effectively when you might wonder how long to do it or when to apply it. And so quintessential applications becomes a guide for all of us. Resist? Okay, so stand up and go around the other side of the table since we just did the knee. And do the squat again, just from the middle of the camera. There you go. How much better?
There's almost no, I can squat normally with almost no pressure at all.
Okay, very good. I'm sure everybody sees that as well.
Now the pressure was worse than the pain, and the pain's gone completely, and it's almost, I can't.
Very good. So rotate your arm down on the right and then up on the right. Well, we've already restored that range of motion. How much discomfort when you go up?
Very little, if any, maybe a half of it. Just feel tightness as I'm pushing it back.
Turn around and face that way. And rotate this one down. Okay, it's still restricted and up. Okay, so we still got restricted range of motion. And how is the discomfort?
I didn't feel the discomfort though. That was the big difference. Normally when I get here, if I push into it, I could feel a pull. I could pull my shoulder forward, and now I don't feel that at all.
Okay, that's a 2-month-old injury. And what about the groin pain? Go ahead and touch that.
That's a lot better too. Normally just light pressure, I would start to feel like a diffused pulsating pain, and I'm pushing now. I mean, it's a little sore, but if I push the inner side, it's a little sore too. And nothing compared to what I was doing. Light touch, I could feel before, now I'm pressing.
So how much better?
And substantial. Maybe we call it a 1 when I push hard.
Okay.
And that was, I guess that was the one that was about a 5, just with barely light touching.
So about an 80% improvement. Not bad.
At least.
For government work.
Yeah.
Lie on your back. So let's go on with this process. First of all, we have a weak muscle, I believe. Clench teeth? Yes, we do. And it responds to autogenic facilitation. Clench teeth? Resist? And we have the person clench teeth because they're lying on their back and we're testing an extensor muscle, right? Okay. So the next thing we're going to test is a little white powder on the tongue, aspirin, acetaminophen, ibuprofen, to evaluate prostaglandin pathways and fat metabolism. Clench teeth. And there's no strengthening response. Resist. And there's no weakening response. And let's make sure this muscle responds to autogenic inhibition, and it does. Give me your tongue, thank you. We'll save that for the next patient. Okay, this is the next thing is an antihistamine mix. And resist my pressure. Oh, resist my pressure, excuse me. Resist. And the antihistamine mix strengthens, doesn't weaken, clench teeth. but it's strengthened. So there's an allergy component that is present. And let's cleanse your palate. Clench teeth. There's an allergy component that's present. So the first thing I want to do is I want to evaluate. There are two things that I need to evaluate. What's the incoming irritation that's causing elevated histamine, apparently, because antihistamines strengthen. And then secondly is what are the nutrients that might be needed in order to metabolize the histamine itself. So I'm going to test him for folic acid. Go. Got that? Did you swallow it? You did? Oh, gosh.
Yeah, I'll take it in my hand.
No, it's okay. I get it. Okay. This is what happens in the office. As long as they don't choke to death, we're okay. Clench teeth. So folic acid doesn't help him when he tastes it. People say, well, how can it respond so fast? Well, there's a pathway between the mouth and the brain. When you stimulate the gustatory receptors, they synapse in the brain stem, stimulate the nucleus of the tractus solitarius, among other things, which impacts the hypothalamus, which has downgoing reticulospinal pathways. And these just downgoing pathways into the spinal cord that pass through the anterior motor neurons of the muscles that we test. So we have an immediate response to taste if there's a need. Can you taste that? Clench teeth. Now that's 5-methyltetrahydrofolate. So this could be a huge problem for him and a huge finding in the overall response that we might get with him. I'm going to check also B6. Step on that. No, I didn't rinse out your mouth, so if you get stronger, clenched teeth, you didn't. So I know usually I rinse out the mouth between applications, and if you don't, and they are strong to that next nutrient, you don't know if they just stayed strong from the last one, or if they actually had a favorable response from the present one, so you'd have to do it again. So it's a challenge sometimes talking and treating at the same time, although that's the way we do in the office, but we're talking to the patient, not in the same language. Okay, so we found B6 wasn't responsive. I'm going to give you the active form of B6 and see if that responds. And it doesn't either. So I'm going to stop right there. I could test a number of other nutrients, but we've already gotten a favorable response from him. And what I want to do is I want to make sure I get through this process. So I'm going to start testing for foods. Let me ask you, doctor, do you have any foods that you know that you're probably sensitive to?
My biggest weakness is sugar, and then it'll probably be.
Okay, so have you ever been tested for, okay,
No.
for wheat, gluten, or whatever? So I've got some gluten here. Let's just test you for that, since you know that you have a challenge with it. We can have one of three responses if he has a challenge with gluten. Resist. We could have a global weakness, like this, so that no matter what muscle we test, he gets a weakening response. That's a global weakness. That's easy to see. He could also have a weakness on therapy localization to a Chapman's reflex, to a target organ. We have a weakness here. If I pinch over the visceral referred pain area for the small intestine, he gets strong. If he touches over the Chapman's reflex for the small intestine, he also gets strong. So, excuse me for a second, I'm a little under the weather, as you can see. We're going to have him touch the reflexes for the small intestine, and let's see about the large intestine, which is on the side of the leg. No. Small intestine, inside of the leg, yes. Liver, reflex, pancreas reflex, no. So I'm just going to do the small and large intestine reflexes, and I'm going to flip the ankle as we do in an IRT. Again, sending two impulses simultaneously to the nervous system that allows changes in the organ itself. Sit up, theoretically. So what we're doing is it appears that we're making a sympathetic, net sympathetic response by doing this particular treatment. Lie on your back. No, the inside of the leg wasn't present. Resist. You still have that on your tongue. It's no longer weakening him. Resist. And let me take that off your tongue. You don't want that there. And let me see about this motion again. Is that about the same as it was?
Maybe slightly less than what it would have been after the RT, but still past the corner of the room.
Okay, and this one? That's about the same as it was. So we still have some restriction over there.
Not bad, though. It's better than when we started.
Okay, good. And so let me do this. This is going to be an interesting thing. I want you to chew that up. Now, sometimes that particular pill is better.
Leave it on my tongue, right?
Keep it on your tongue, but chew it up. Okay, you taste it?
Oh, yeah.
Resist? I mean, relax. Does that go any further?
Yeah.
It does.
You're only getting past my foot, past the corner, now the whole foot is going past it.
Okay, and stand up for a second on this side of the table. And rotate your left arm towards the camera. Left arm, that's the right arm. Right. Towards the camera. This way. And rotate it down. Maybe a little bit more range of motion than was, but not quite there yet. Okay.
No discomfort, though.
No discomfort. Lie on your back. Go ahead and swallow that. So what I wanted to see is if chewing up that particular supplement made a huge difference in the overall response of his shoulder and or pelvic range of motion. So a little bit of response. Folic acid will check, and the active form will check again downstream. So the next thing to check is he says that he may have some problems with he thought he may have some problems with fungus and mold. So we're in step number 7. And in that step, we do aldehyde sniff, leach sniff, and ammonia sniff to assess the aldehyde pathways, the free radical antioxidant stress, and ammonia metabolism or protein metabolism in the body, respectively. So I want you to smell this. That's a perfume. Resist. And he weakens, resist, to the perfume. So we'll wait, resist. We'll wait for just a second. And one of the things that happens when you weaken to a perfume is that you have the possibility of fungal problem. And fungus, as you know, give off aldehydes. And aldehydes require molybdenum in order to be changed into acetic acid and be used in other pathways or eliminated. So I want you to, if you can't taste that, then we have a weak muscle right here, right? Clench your teeth. And it strengthens to molybdenum. This his mouth out. Get out, good. Strengthens to molybdenum. I'm going to test a couple of other things. Selenium. Taste it. Clench teeth. It doesn't strengthen to selenium. We could test a few other nutrients associated with that step number 7. But I'm going to stop right there with molybdenum, which is the most common nutrient found in this particular issue, and see if, actually I need that molybdenum back, see if the molybdenum actually negates the weakness induced by the sniffing of the aldehyde. Sniff. And all smells, smell that? Mm-hmm. Resist, all smells essentially have aldehydes as the active ingredient. So the molybdenum negates the weakness associated with the aldehyde sniff. And what we're going to do is we're going to consider supplementing him with molybdenum. Now we're going to just have him sniff. We're going to induce the weakness. And we're going to try to find Chapman's reflexes that negate that weakness. The liver reflex. The pancreas reflex doesn't. Stomach reflex doesn't. Small intestine does. Large intestine doesn't. Brain does. Parathyroid doesn't. So I'm going to IRT, in other words, flick the ankle. Snip. You don't lick the perfume.
I don't want to drink that.
That's right. So we're going to IRT these Chapman's reflexes. Brain. That was small intestine, liver, and brain resist. And let me have you sniff again. Because this is a chemical sensitivity, I want you to touch right here in the middle, just to make sure lower sternum doesn't show up, and it doesn't. Let's take a look at this lag range of motion. It's about the same?
Yeah.
It's about the same. Right? So the next things to do is to test bleach, sniff. No? Okay. We're looking for a weakening response, or sometimes clenched teeth, a strengthening response. And then ammonia, this is pretty strong, it's new. Oh, good. It's a wonderful thing. Resist, and it doesn't weaken or strengthen. So we're now on step number 8A and B. He says he has a fatigue problem. We know he has a folic acid issue. So because he has a folic acid issue, and folic acid, when given, can hide a B12 problem, we want to check him for B12 and maybe iron. So I'm going to check him for B12 in its active form first. One active form. And take that out of your mouth. Thank you very much. And then the other. And resist. And neither of them show up. And just to be devil's advocate, that was adenosylcobalamin and methylcobalamin. And I'm just going to try hydroxycobalamin because sometimes you just never know what the physiology wants. And that doesn't show up either. And I'm going to try a source of iron. And people ask, well, which company do you use? I say, well, any company that works. And as you all know, that's the reality, is that whatever works physiologically for the patient is what we want to use. Resist, clenched teeth. And that doesn't cause a response either. Could I test other sources? Yes, I could. But I'm pretty assured that that's probably not the issue. I haven't seen a CBC, which I would want to see under these circumstances, to determine whether the mean corpuscular volume was elevated beyond 91, or if the polysegmented cells and the lymphocytes were out of balance in the ratio. I don't have that at this particular point, so I'm going to go on. So now I have 8C. He hasn't told me anything about a cholesterol issue, so I'm going to skip that. 8D, he does have joint problems, and so he could have a chondroitin sulfate issue. He does say that he craves sugar, so I'm going to test him for chondroitin sulfate, put it on his tongue, and clenched teeth. And he responds favorably to chondroitin. And if he responds favorably to chondroitin, then I'm going to test for L-cysteine. Nice, yeah. It's a little sulfur tasting, that L-cysteine. Clenched teeth, and clenched teeth, and clenched teeth. And it does strengthen. Now, if L-cysteine strengthens, then we need to check. Oh, great, so I need to do this again. This is what happens in real time in the office. Yeah, that's right, I appreciate that. So, clenched teeth, and it strengthens. Okay, so we know now that purified chondroitin sulfate strengthens, cysteine strengthens, suggesting that there's a sulfur metabolism problem. Purified chondroitin sulfate is made from sugar molecules, which means a sugar metabolism problem could be present, and sulfur being added to it, which means sulfur metabolism could be a problem. In his particular case, he responds to cysteine, which suggests sulfur metabolism, and that implies there's a problem with some nutrients. B12, folic acid, vitamin B6, magnesium, and molybdenum. The only thing that we haven't tested of those things is molybdenum, correct? I mean, not molybdenum, I mean magnesium. Magnesium. So I'm going to check magnesium, because we already know that he doesn't respond to B12, he doesn't respond to B6, either in its active form or its dietary form, that he responds to 5-methyltetrahydrofolate, HT. He doesn't respond to magnesium. So the other possibility is that he also has a sugar handling problem. But the sugar handling problem, as you know, when he has histamine elevation, it could be because histamine is the most powerful irritant to the adrenal gland. It could be that the histamine is actually driving adrenal dysfunction, which is driving sugar imbalance, which is causing him, with this round-robin effect to the pancreas, to crave sugar. So it's possible that he has a sugar problem that is really related to the histamine issue. So, but let's see. I'm going to give him glucuronic acid and see if he responds to it. Now, if I'm in this process, clench teeth, and he doesn't respond to glucuronic acid, and I can't remember, do you test? I can't get the tissue out of the nose. Okay, good. And this is what I'm talking about, out of the nose. Okay. So he doesn't respond, clenched teeth. But if I have a question, I have my book here. And yes, I know, I'm one of the co-authors of the book. But I have the book here so that I can look and say, so I test for glucosamine and glucuronic acid. That's right. So now I can just leave that open to that page, and I can say, let's take a look at glucosamine as well. You can hear a phone ring in the background. It's because I failed to turn off my phone and put it on hold so that the phone wouldn't ring through. I went through a lot of light. Ink, clench teeth, resist, and neither glucosamine nor glucuronic acid causes strengthening response. So we already know that we tested for the nutrients associated with that metabolism for the healing of joints. And especially we're looking at molybdenum, which turns sulfide into sulfate, as well as assists in converting aldehydes. And we know that he has a folic acid need, 5-methyltetrahydrofolate, which takes homocysteine and recycles it into methionine as you build sulfate. So we'll put these back on the shelf so we can find them later. And we're at step number 9, so I want you to touch right here. And we're going to use a strong muscle because he's touching K27, and we're going to use a strong muscle. Now take your hands away. Resist. We're going to use just the gluteus medius, a little bit higher, right there. Resist. And we've got a weakness that occurs when he touches K27 hands down, which means he's got a cranial fault. Touch right there. Both hands. Resist. And so while his hands are there, I have a weak muscle, so I can just rub a cranial bone, and I find out the first cranial bone that I rub, the right frontal, causes a negation of the weakness induced by the therapy localization to K27. So I'll have him touch that cranial bone. We already know that this muscle is strong. It does not get weak when he touches the cranial bone. When he tips his head back, it does, which suggests that there's an immune system problem that's driving this cranial fault manifestations. Tip your head back. And so I'm going to rub the visceral referred pain area for the thymus, and that strengthens. And you can tip your head in normal position. I'm going to test thymus-related muscles, clench teeth. And he's got a weakness of the infraspinatus on this side. I want you to touch right here. I'm going to check clench teeth on the left side. I'm going to check to see if there's an emotionally driven immune response. And then something we haven't discussed yet in this webinar series, but we will discuss in subsequent visits. Excuse me. Got that on your shirt. Going to charge. I'm going to put a little hypothalamus on his tongue, clench teeth. And the hypothalamus actually strengthens the immune response of the immune-related muscle, which suggests that the problem is coming from outside the immune system. Normally, I would rub this reflex for the thymus. But in this particular case, I know it's coming from some other organ system. So I'm going to test him sympathetically and parasympathetically and see what happens to the muscle strength. Look at the ceiling, any point on the ceiling, clench teeth. Look at the tip of your nose, clench teeth. Look at the point on the ceiling, clench teeth. Always look at a point on the ceiling. You'll be fine. Okay. So when he looks at a point on the ceiling, it means there's a sympathetic problem, which means that I need to find some reflex that I pinch. This will refer to pain reflex that negates the immune-related weakness. Clench teeth. The immune-related muscle weakness. Clench teeth. Well, we thought it was going to be small intestine. Clench teeth. We thought it was going to be large intestine. Clench teeth. But in this particular case, it's the adrenal reflex, which is located here at the end of the rib cage, about C11. Clench teeth. That's the visceral referred pain area. You'll see that on the left-hand page, 23AB, in the Quintessential Applications Manual. So what we're going to do is skip ahead now to step number 15. And we're going to assess, touch the Chapman's reflex for the pituitary, rub the Chapman's reflexes for the adrenals, resist. And he weakens under those circumstances. I'm going to have him put his hands here. I'm not going to test for nutrients because of time, although that may be for a subsequent visit. But I know that he has a histamine-driven, potentially histamine-driven difficulty with the adrenals causing a sugar handling problem. And so I'm going to, the challenge substance I'm going to use is histamine. And I happen to have some homeopathic histamine right here. And I'm going to just put a little bit on his tongue. And I'm going to have him touch the Chapman's reflexes. And I'm going to retest the strong muscle, resist. And it weakens. I'm going to IRT the Chapman's reflexes. I've skipped the nutrient testing in that step number 15 in the interest of time. And then we're going to reassess clenched teeth. This muscle, which is the immune-related muscle, which strengthens clenched teeth. Whether I have the other on his tongue or not, touch right here for the Chapman, for this K27. And that doesn't weaken, and touch right here and tip your head back. And all of that is corrected now. So the cranial fault manifestation was corrected by an immune system problem that was secondary to an organ issue. Again, in sessions 14 and 15, which are coming up in our webinar series, we'll discuss those things. So touch here with your knuckles down. And try not to touch the knuckles together. There you go. Push outward. And so he's got a weakness with the knuckles down, which we know to be a TMJ problem. And when I rub the left TMJ, he strengthens, resists, and when I rub the right TMJ, nothing happens. So I'm going to have you push toward me. I'm going to have you touch the left TMJ. Resist hard. And that causes no problem. Tip your head back. Resist. But with his head tipped back, it does. Tip your head back. I'm going to rub over the spleen, visceral referred pain area, and it shows up. And so I'm going to test the lower trapezius, which is related to the spleen, clenched teeth. And the lower trapezius is weak. So I'm going to have him touch the neurovascular reflexes, emotional neurovascular reflexes, clenched teeth. And that doesn't strengthen him. I'm going to, again, use this hypothalamus on his tongue to determine whether the hypothalamus is mediating a problem that's coming in from a distant organ that's causing immune system issues, clenched teeth. And sure enough, the hypothalamus tissue shows up again. Now, clenched teeth. Okay, look at the ceiling, clenched teeth. So looking at the ceiling doesn't strengthen him anymore. Look at the tip of your nose. What that does, so that means rubbing some area. Now, if I've downregulated an adrenal function that's been upregulated by histamine, what do you think the adrenals are doing now? They're exhausted. They're tired. So the first thing I'm going to do is I'm going to rub the visceral referred pain area that I just pinched before to see if we just need to rub those adrenal reflexes. Clenched teeth. And it appears that we do because it's strengthened. Now, I am going to change my mind and test at least one substance, maybe two, that are related to adrenal function because we've seen this twice now. The adrenals are a bit low and they're affecting immune system function, clenched teeth. And that's pantothenic acid. So we're going to consider pantothenic acid in this patient as well. And I just wanted to demonstrate that. But at this particular point, what I'm going to do is rub the Chapman's reflexes. So to upregulate organ function. So when I rub these Chapman's reflexes, we actually appear to increase adrenal function in the rubbing. Now, Chapman's reflexes, as you all know, were discovered by an osteopath palpating patients' bodies in a hospital in the 1930s by the name of Chapman. He spent 5 years correlating these tender areas on the body with organ systems with known diagnoses of patients in the hospital. He found that rubbing them created a favorable response, or appeared to create a favorable response in the clinical outcome. So as we do these reflexes, rub these reflexes, both on the front and the back, we think about the history of this process and that it's a long-term clinical observation. Dr. Goodhart used to get a huge response from rubbing Chapman's reflexes in patients that he demonstrated on in his lectures in the late 60s, early 70s. So then we retest the immune-related muscle, clenched teeth, and there's a strengthening response, and we go back to touching here, tip your head back, resist, and that doesn't weaken, and now touch here with your knuckles down, push outward, don't lift your leg up, and now put your fingers down again, like that, yes. And now cross your knuckles. Knuckles, yes. But don't touch your wrists. Clench teeth tightly or slightly. Resist. Okay, very good. So we're apparently through steps 9, 10, 11. Dr. Schmidt kind of taught me this when I was in the office, and he's mentioned it in the class, but there's one other immune-related muscle that is present, and since the immune system was involved, I want to test that muscle just in case I'm missing something. Clench teeth. Well, actually, he doesn't have to clench his teeth. Resist. Push toward you. Clench. Okay. Good. And this one? And that's pectoralis minor. It doesn't seem to be weak. So we're on to the next step, and the next step is step number 12. Clench teeth. Step number 12 requires a weak muscle. We don't have one at this particular point. We have 12 minutes left. So I'm going to skip that for right now. That's citric acid cycle function. Except that I'm thinking about it and I'm saying he has an energy-related problem. Histamine upregulates nitric oxide, which interrupts the aconitase enzyme, which truncates the citric acid cycle. So maybe the citric acid cycle also needs assistance. Well, pantothenic acid is related to the citric acid cycle. So maybe that's the assistance that it needs. But I should probably have him breathe in a paper bag. And there happens to be a paper bag across the room. And we have an assistant here that is going to pull out that paper bag and hand it to me. Thank you very much. And I need to find a weak muscle. So I'm going to go back up here, and I'm going to palpate this TS line again and see if I can find something. Clenched teeth, resist. Yeah, it's interesting. Latissimus dorsi TS line point showed up on the right side, clenched teeth, and it's actually weak. You can't see it in this angle from the picture, but let me pull it up. Clenched teeth, resist. So there's a weakness that's present. So what I want you to do is I want you to breathe in a paper bag. I'm going to open this paper bag. This is one of our very expensive, new-fangled evaluation techniques. That's right. I'm going to have you breathe 6 or 7 times. How many times is that? 4. And 1 more. Okay, very good. Throw it away, keep it for somebody else, clenched teeth. But he doesn't have a response to the ingestion of carbon dioxide, the upregulation of carbon dioxide, which is thrown off by the citric acid cycle. And therefore, that cycle is not indicted at this point. It might have been indicted had we tested earlier because of the things that we organize relative to his physiology. It's not present now. Now, the next step is step number 13. That's heart-focused activity. And what I'm going to do is I'm going to test for heart-focused activity by having therapy localized to the acupuncture point for the heart, resist, and then thinking about the area of the heart, center left. And if that showed up, then I'd know that I need to teach him heart-focused activity right now and treat him with it at this particular point. However, it didn't. We've already done steps number 14 and 15. So I'm going to check step number 16, adrenal challenge technique, resist, to see if it weakens an adrenal-related muscle. It doesn't. And then, because we have a ligament problem, potentially, I'm going to stretch this arm, resist, and I'm going to test, and we don't have a ligament stretch adrenal stress problem. And then we're going to take our last known weak muscle, clenched teeth, and it's still weak, and we're going to pinch the liver visceral referred pain area, and we're going to rub the liver visceral referred pain area. And neither of those strengthen the weak muscle. Resist and resist. However, you could have an upregulation of cytokines, and I would do thymus thump, a test against the pectoralis major sternal division to determine that, and as well as other things. That doesn't seem to be present. I'm going to test the long head of the triceps, resist, and I'm going to, the biceps, thank you, long head of the biceps. It's a good thing we have a doctor on the table. He can correct any of my mistakes. Resist. And he does have a weakening response to pinching over the visceral referred pain area of the pancreas, which indicates that he potentially has a sugar handling problem, which didn't show up earlier. So I could test nutrients. Again, we only have 8 minutes. I could test nutrients associated with this, but I need to find an offender to this pancreas reflex. Now, it didn't show up earlier when we were using gluten, but I'm going to look at gluten again to see if it shows up now, because sometimes these things show up in layers in the body. It won't show up initially, and it will show up subsequently. So I'll put a little bit more used to. I'm meant to, on the tongue, resist. I'm going to test this muscle, actually. Test this one, and I want you to touch right here. Chapman's reflex for the pancreas. Resist. And sure enough, it does show up as an irritant. I'm going to, again, flick the ankle. Resist my pressure. Touch right here. You take that off the tongue. Upward. Pinch. Resist. It doesn't weaken in. There's a second part to that response. It's the gait testing, which I'm going to do after, at the very end, which is pretty close to here, but I'm getting there. Now we have emotional issues. We haven't seen anything relative to that. Touch right here, and when he touches, the emotional neurovasculars are not present. Now we're into actually we should have done the digestive tract. And so we're going to check the ileocecal valve. Let's use this and this. And we don't have any other issues. I'm just going to skip down to here. So I've done a very rudimentary evaluation of the digestive tract, which doesn't seem to show up at this particular point. And now structure. So do we have any weak muscles left? Clenched teeth? We've got this Latissimus Dorsi. I was doing origin assertion of like pec minor, etc., but the Latissimus Dorsi is in that same area. Maybe I missed it. Clenched teeth. And it's very tender, so I'm going to manipulate the Latissimus Dorsi very deeply into that shoulder, as you can see, with my thumb. I should have gotten down this low when I first manipulated, but as you know, although autogenic facilitation is sometimes working, local issues of irritation or muscular injury many times persist. Clenched teeth. And so we have a strengthening response there. So that's the only weak muscle that we know of. I want to turn him over. Yeah, face down. And in the interest of time, I'm going to check the Iliolumbar Ligament. Resist. Check the Iliolumbar Ligament. And I'm going to check the sacrotuberous sacrospinous ligament by digging my thumb into the belly of that ligament. And then I'm going to check, put your hands right here for category 1, resist. I could have checked for a category 2, but his pelvis was on straight. And when he was lying on his back, it didn't seem like he had a short leg on either side, so I'm going to skip that. I'm going to have him lift his head up, resist, and turn his head to the side, resist, and turn his head to the other side, resist. And I'm going to put his fist against the side. There doesn't appear to be any fixations in the pelvis. And I'm going to pinch along the spine. And that doesn't seem to show up either. So we're getting lucky. And sit up. And stand up, if you don't mind, on that side. That's right, on that side of the table. And let's have you stand facing the camera. This is the side. Step back with this foot. Resist. And that weakens. I'm going to pinch the viscerally third pain area. Resist. And it strengthens. It shouldn't strengthen. Touch right here. So if he touches the Chapman's reflexes for the pancreas, there is a restoration of normal function, which is in this gait position, a weak latissimus dorsi. And now I'm going to rub this reflex. And I'm having to step back, resist. I'll step forward again, step normal. Step back with your left foot, resist that pressure. There you go. And let's pinch this area, resist. And I could check in for sugar response. So at this particular point, we're going to do that. Turn face this way, please. Put a little sugar on his tongue. Oh, a little bit more than we anticipated. Face this way, step backward. We're going to test this, well, resist. And there's a weakness, and resist. And it's still weak, so it's not a sugar response. I take that out of your mouth. I ran out of tissues. So just go ahead and swallow that, contrary to my own advice. Face that way, and rotate your arm down. Pretty close. Rotate the other one downward, and rotate this one down. They're pretty even at this particular point. Rotate them up and back. And those are also very, very good. So touch this area in the groin again. You said it was a 1 before. You don't feel anything. Could you say that louder, please?
I feel nothing. Spot that hurt.
Okay, good. Good. Marvelous response. Turn to this way. Stand on your right foot. Okay, before we go on, we had about 5 seconds. Didn't really have an improvement. Chew that up. Chew it in your mouth. Chew it up and keep it in your mouth. Stand on your right foot. "19 seconds, not anywhere near as much dancing, which he had in the first 7 seconds, from the folic acid. So he's got a folic acid need that's very, very important to him. This kind of neurological change is something we commonly see but is not seen in other venues as quickly as this. So we know that he needs this folic acid and probably these other nutrients, and it's 1 o'clock. And so I'm going to step forward and open up. You'll see me in front of you for just a moment. Good. I know you can. Open. There we go. I'm going to go to the question area real quickly. And it says, Karen, have you ever found a need to prescribe an antihistamine and found no or that there's a need for a histamine and found no antihistamine nutrients test? Yes, sometimes of course, there's not a nutrient that's needed, but a offender that needs to be withdrawn. So either way or both. Usually, it's both. In this particular case, we found a nutrient, just one nutrient. We didn't test them all. Normally in QA6, you would have recheck histamine mix after correcting gluten to see if there was another allergen. What I would normally do is test to see if there was a number of allergens. I wouldn't retest the antihistamine mix. I try not to put those on the tongue any more often than is necessary. But I would retest, I would test a number of offenders. We were lucky with him. He had a history, he kind of knew himself, we were able to get gluten. But even if I got gluten initially, on a normal office visit, I would look at gluten and milk and corn and brewer's yeast and baker's yeast if that was indicated, and so on and so on. Soy products. I'd test 10 or 12 of the offenders, normal offenders, to try to assess which ones, not which one, but which ones might be appropriate. We got a very favorable response in this particular situation, which I'm grateful for. I appreciate everybody who is here today. Thank you very much. I'm sorry I couldn't do everything by myself, but I think it was hopefully edifying for all concerned. If you have any questions, please write qapplications@aol.com, and I'll be happy to answer your questions. Have a wonderful week. We're going to come back in 2 weeks for the webinar part 1 of session 14. Thank you all.